And thanks to the Urban Health Collaborative for this invitation and for bringing us all together. Catherine, thank you also for teeing up transportation in your slides and kind of connecting it very well to this slide. What I want to try to do first is provide a framework around which I kind of build the transportation evidence of how it affects climate and urban health, and then give you specific evidence of the Salud Val study. So this is a large Latin American study focused here, starting here, housed in the Health Collaborative, that is close to 10 years old, so 9 years going on to the 10th year, and that has focused on 371 cities in Latin America in 11 countries now. So let me tell you a little bit about how I think about transportation and maybe hopefully kind of expand your mind a little, because the traditional view in most of our studies tends to be on the top box here. So it's the transportation infrastructure, the sidewalks, the busways, the subway, maybe the roads. And although that matters a lot, there is increasing evidence from many, many different cities that is the second box that seems to be mattering as well. So it's the policy factors. Not that the infrastructure is not a result of policy, but some of the policy that accompanies the infrastructure. The fares, the frequency of bus transit, maybe the span of service, when does it run? Maybe it's the cost of parking, or maybe are the controls on emissions technology. Do we need to bring our car for emissions if you're driving a car? Or maybe it's a low emission zone, places where cars cannot go in. Some of these policy strategies that seem to be very promising in terms of addressing some of the CO2 emissions in cities and also providing many health benefits. What transportation does, together with land use, is create the geography of opportunity. So here we'd like to talk about accessibility. A little different from kind of the disability notion. It's thinking about the potential for interaction in space. So transportation urban development gives you a landscape of opportunities, be it access to jobs, schools, food stores, grocery stores, parks, recreation, all of these options, some of which we might actually engage with and go to them, some of which just stay there and just as the possibility of interacting, but they might not materialize. As we move to the right, we see now the behaviors, the travel behaviors, the health behaviors that are associated with that geography of opportunity. So in here we might characterize things like, why are you traveling there? Maybe you're traveling to work. Maybe you're traveling for leisure. You're going for a walk. You're going for a run. Maybe you're going to a recreational site to have a good time with friends or family members. What mode of travel are you using? So do we walk, or do we take the bus, or do we drive? And then how frequently do you travel? Do you do this a few times a week, many times a week? At what time do you travel? That's also going to be important as you think about some of the pathways that I'm going to show here to the right. The exposure pathways that Catherine was describing, here are some of them. Many of these highlighted here have negative impacts, so things like emissions and air pollutants. Maybe it's heat if you're walking through certain urban canyons in a very hot day. Maybe it's noise. But some of these could also be salutogenic, things like green spaces, things like blue spaces. And our behavior in space will allow us to be exposed to this. Together, those exposures and even the activity, the travel activity, the health behaviors activity might impact the health outcomes for individuals, for us, for our neighborhoods, and even beyond kind of the specific way we think about health in terms of mortality or morbidity, the overall well-being. Maybe it's how we report how we feel in terms of our own well-being. So let me zoom into a few findings from the Salud Val study, and I'm kind of anticipating one of the gaps, and is that either we don't have a lot on policy, or it's really hard to measure the impact of policy on some of these outcomes. And so that is a big challenge. The boxes in red here highlight the focus of some of the results that I'm just going to present in the next couple of slides. So a lot on mass transit, a lot of how people travel, some questions on heat and emissions and mortality. So what have we found in Salud Val in this large collective effort? First, the importance of mass transit. So mass transit is associated with low infant mortality. Mass transit associated with lower road traffic mortality, lower likelihood of reporting depressive symptoms, and from a study on the cable car in Bogota, improved subjective well-being. How we travel is also very important. it's important that we measure it so that we can track it. It's important to understand why we're not measuring so that we can act at the city level. To give you an example of these 3 large metropolitan areas housing roughly 40 to 45 million people, on the left-hand side you see the percentage of the city population that meets the WHO guidelines for physical activity. So more than 150 minutes a week of moderate or vigorous physical activity. So this is saying that about 10% of the residents of Mexico City meet those guidelines just from walking fully to and from places. So think about you walking to maybe your child's school, dropping off the child, and maybe you're able to walk to work, and then you come back from that trip. Fully walking trips. So it's between 7.7 for Santiago and 12% for Bogota. Then the middle panel here shows the percentage of the population that meets the guidelines from walking to and from transit exclusively. So we're thinking here about transit as a public health intervention. And notice the range is much wider, but still the numbers are higher. So about 9% in Mexico City and 15% of Santiagueños are able to meet the guidelines only from walking to and from transit. Now this could be an indictment of the coverage of the transit system in Santiago, possibly. But if we add both, we're getting to roughly a quarter to a fifth. So between 20% and 25% of all the population in these metropolitan areas, 10 to 15 million people, meet those guidelines from walking, from any type of walking. Either they're walking to places or they're walking to and from public transportation and connecting between buses and transit. It's pretty amazing. Now, why do we have only 3 cities here? Because the other 6 cities that we were examining did not measure this type of walking. For those cities, what mattered was you use the bus. And there's good reason for that, but we're missing a chunk of the walking benefits in those cities. And as a result, we're also losing the argument for why we need to be funding public transportation for many of these co-benefits. Of course, cars are a big part of this discussion. So more cars and higher levels of congestion have been associated in our Latin American cities with higher concentrations of pollutants, no surprise, NO2, PM2.5. And we've also found separately that higher PM2.5 is associated with higher cardiovascular mortality as well as respiratory mortality. We found that more cars and more car use is related to higher incidence of depressive symptoms. And of course, cars beget car use. So the more cars there are there, the higher the levels of congestion. What are some of the challenging trends, some things that worry me in this context? First is the fact that support for funding public transportation is waning. This is very parallel to what's happening in the US. It's not uniform. Some countries are having some support for public transportation. Brazil is again talking about fare-free transit. Interesting, maybe not very focalized in terms of who will benefit, but interesting discussion. The US is facing the fiscal cliff. Some of the large cities in Latin America are facing fiscal problems to fund public transportation. Of course, you localites have seen the headlines, are suffering the headlines from what's happening with SEPTA. That's that discussion. Car ownership is going up really, really fast. We're comparing our data for these 371 cities between 2010 and 2015. It shot up in 5 years, 30%. So this is dramatic because the average motorization rate is about 271 cars per 1,000 residents in Latin America. Some cities are higher. Some Brazilian cities are close to 600, 700. Others are lower, are in the 150 range. So there's a lot of room for growth. But the US is around 1,000, 1,100 private cars per 1,000 residents. So we do own more than 1 car per person in the US. Bicycling remains dominated by low-income residents, and yet the increase in bicycling over time is highest in high-income groups. So that's an interesting trend as well. And the urban safety road programs, especially lowering speed limits, have been very successful in reducing road mortality, but that doesn't mean always that they stay in place. In fact, their longevity changes with the political winds. Again, why wouldn't we keep something implemented that is working very well in terms of public health? That is the challenge for us. To end, what are the opportunities that I'm seeing? Expanding that transportation sector box to think beyond the infrastructure, connecting to other sectors, a variety of different sectors that many of us have been discussing today and will continue to discuss. And I think addressing transportation's vulnerability to many climate-related hazards. So the infrastructure is exposed to a variety of different hazards, but then the travelers are also exposed to a variety of different hazards, often simultaneously. And I think this layering of exposures is going to be very interesting to study and to understand what mitigation actions are going to be most promising. And lastly, it's in our activity in space where all of these different sectors of the city converge. If I'm facing high pollution, noise, heat, and road risk, whose responsibility is it to look after my wellness? Is it the Parks Department? Is it the Housing Department? Is it the Planning Department or the Transportation Department? Or the Resilience Officer? Or a mix of all of them? So this question about governance becomes really, really critical to address these vulnerabilities that are layering up. Thank you.